Hi, everyone. Welcome to SDP Connect. My name is Christiana Morales. I am the Director of Self-Determination Program here at DV United. It's so good to see everyone. We saw a lot of you just yesterday as we rolled out our Senate Bill 1281, which is so exciting. If you weren't able to come to our rollout for the bill and meet Senator Menjivar, it was so great to see her speak. She's so vivacious and just really understands our community. We will put in the chat the link to the outline, what the fact sheet for that bill. The meeting was recorded, but we don't quite have it up yet on our YouTube. So we will let everybody know when that goes up. Before we get started, I want to remind everybody that we do have interpretation in both Spanish and Korean. So please go to the bottom of your screen, select the globe, and select your language. Even if you speak English, make sure you select English, because if somebody has a question interpreted, you won't hear it interpreted. If you're on your cell phone, go to the bottom of your cell phone, and there are three dots, and select those three dots, and you will see the languages pop up. So we have a great presentation today. I have one quick announcement. We don't have a lot of announcements. Just so you know, our president, Judy Mark, is not with us today because they are having the California state budget meetings today. And she is actually in Sacramento speaking at the hearings. So go, Judy. And the other thing she's going to be doing is on Friday, she is going to be at the CalTASH conference. So if any of you will be there, go find Judy and say hello. She would love to see you. For our events, we have one quick flyer, which is, I'm going to share my screen. If you want to come visit with us, we are going to be at the Club 21 Resource Fair on March 9th. So not this Saturday, the following Saturday from 10 to 12. It's in Pasadena, California. If you live in the area and want to show up, it is free to participants. So come by, say hello. We would love to chat with you. We'll put this flyer in the chat as well. So today our presentation is based on a grant that we have from the Department of Developmental Services for CIE, Competitive Integrated Employment. And our grant was to do a series of trainings on employment and the self-determination program. This is part 2 of a 3-part series. So at our last Connect, we did part 1. We talked about self-determination program and how it's kind of different from the traditional system and what the services you can get. The feedback that we got from that, from our case studies and research we did as we were going into it, is the number one concern people had about employment was losing their public benefits. And so we realized this is a very big issue, a very serious concern that everybody has. And so that's what this second part series is going to be all about: the Social Security benefits and the impact of working on it. But before we get started, because it is a grant, we have been asked by DDS to do a pre-survey and a post-survey. I apologize. I know they're not the funnest things to do on the planet, but if you will please go, the link is going to be in the chat. It's a super quick 6 questions. It will take you just a moment to do. I would really, really appreciate it if you could do the surveys. And as you are getting that done, I will get my screen set up here. Give you just a little minute to do it.
Hey, Christiana,
Yes.
when I went to the survey, it says I've already taken it, so anyone that's taken it last time is probably going to get that same response.
Oh, they might give you an error response. So if you have taken it, that'll be okay. If it lets you take it again, that's great. Take it again. That would be awesome. Thanks, Tina. Okay, thank you all so much. I am going to start sharing my screen here. As we talked about, this program is called What Works for Us. And this section, this is part two of a three-part series, is unemployment and public benefits. My name is Christiana Morales. As I said before, I'm the Director of Self-Determination Program here at Disability Voices United. I am also the parent of a 22-year-old who is in his third year of the Self-Determination Program. Tim Jin is going to be presenting on his experience with um, benefits and employment. And Pamela Haney is going to be, she is our expert because I am no expert in this. I am the first one to tell people I am not an expert in this. So we absolutely needed to bring in an expert. Before we get started, I wanted to talk a little bit about how we came up with the information for this grant. We did 20 case studies. We went to the experts in self-determination who are the participants, and we did 20 case studies, and they told us their stories about employment. And that's what all of these trainings are based on: input from the community, input from them. And so as a parent, I will tell you, the fear of losing benefits is a real fear. It's something I worry about all the time, but I think there's a difference between a fear. Um, you can have a fear that's rational and a fear that's irrational. And so I'll give you a good example. A rational fear is, I'm afraid of alligators, right? Alligators scare me. It's a rational fear. But I happen to live in Los Angeles. Probably not going to run into an alligator. Not an issue, right? If I lived in Florida, would probably be a more rational fear. So I want people to kind of keep that in mind as they're thinking about this. These are very real fears, but I want you to know that there are absolutely ways that you can protect your benefits, and you need to get the right help. I do not want you to ever not work if you want to work because you are concerned about this. So it's really important that while it's a real fear, it's a fear we really should get over. We need to get over, we need to work on this. So with that in mind, I am going to hand it over to Pamela Haney, and I'm going to let her introduce herself because she's going to be much better explaining what her experience is. Welcome, Pam. Thank you.
Thank you. I appreciate that. So hello everyone. This is gonna be a little weird for me because I can't see any of your faces. So I'm gonna do my best to be engaging and dynamic here. So my name is Pam. I am a certified community work incentives counselor, also known as a CWIC. What does that mean? That means I took a big, long special training that is authorized by the Social Security Administration that taught me everything I could possibly want to know about work and Social Security and other types of federal benefits as well, including Section 8, SNAP, Medicaid, Medicare, things like that. I've got 13 years of experience providing employment services to individuals with intellectual and developmental disabilities. So I've been a job coach, I've been a job developer, I've been a trainer, I've been a supervisor. So I really, kind of what I do, what I spend a lot of time thinking about. I work for Progressive Employment Concepts, and I provide benefits advisement services through the self-determination program, as well as Ticket to Work. Next slide. Thank you so much. So this presentation is going to focus on working while you receive Social Security benefits of some sort. I do want to throw out there, just so everyone is aware, that should you choose to seek out benefits counseling in the future from me or anyone else, anyone who has the type of training I have will also be able to help you with things like SNAP, Medi-Cal, Medicare, ABLE accounts, special needs trusts, Section 8 housing, all of those scary things people think about are covered in the kind of training that I have. So anyone else who has the same training is going to cover that. Next slide. Right? So in order to have this type of discussion, right? I want to work and I receive some type of benefit from the Social Security Administration. The first question we have to answer is what type of benefit I have, right? There are multiple types of benefits and benefits profiles from the Social Security Administration, and they all have different rules and different eligibility requirements, and different work incentives that are available to them. It can make the bureaucracy a little bit, I think, more confusing if you're not familiar with it. But it is navigable. It is doable. You just have to know what you're looking for. Next slide. The first type of benefit that we're going to talk about is SSI. This also stands for Supplemental Security Income. SSI is a term most people are aware of. It is also known as a Title 16 benefit. It's a Title 16 benefit because it is outlined in Title 16 of the Social Security Act. If anyone is interested in reading some really dense legislation, it's actually an interesting read. So what type of person gets SSI? What are some indicators that you get SSI? It's means tested. So you have to be both poor and also meet Social Security's definition of disability. It always comes with Medicaid, which is called Medi-Cal in California. We're special in California. Everything is named something Cal in California. SSI cares about all of your income and all of your assets, no matter the source. And the benefit decreases slowly with earnings, but it is always profitable to work for an SSI beneficiary. SSI beneficiaries are subject to a $2,000 resource limit. So that means that you can't have more than $2,000 in a combined total of all of your countable accounts. And it's also subject to the in-kind support and maintenance rule. In-kind support and maintenance means that if you receive assistance from a friend or family member, paying rent or food, perhaps you live with your parents and you don't pay them rent, then Social Security is going to reduce your SSI benefit. That often impacts a lot of younger folks, and they don't realize that they could be getting the full, $1,194. They're only getting $800. Oh my gosh, why is it so much more? Because your parents aren't charging you rent. Next slide. Right, so now we've learned a little bit about the profile generally of who gets SSI. Let's talk some about work incentives, right? Social Security really wants you to work. Work incentives for SSI is all about reducing your countable income so that you can keep more of that cash benefit as your earnings go up. Like I said, Social Security reduces that benefit gradually as your earnings go up. So think of it like that. There's also a work incentive that allows you to keep your Medi-Cal after you stop getting SSI. I would say that is probably the number one concern that I hear. What's going to happen to my health insurance? I don't care about the money. I need health care, and health care is more expensive than any amount of money I could possibly make. Well, we're going to talk about that here on the next slide. These are the terms that I kind of want you to remember as we talk about SSI work incentives. There's the countable earning income and earnings division. So that means there's a calculation where you can factor in all your countable earnings. And then for earnings, not unearned income, but earnings from work, Social Security will divide that countable portion by 2. And that's the amount that gets deducted from your SSI cash payment. That means that if you earn $1,000 in a month, less than $500 will be subtracted from your SSI cash payment. So it's always going to be more profitable to earn more money. There's also something called a plan to achieve self-support, also known as a PASS plan. PASS plans are free money from the Social Security Administration. They're pretty cool, and they're a grossly underutilized resource. I haven't looked up the numbers for 2023 yet. I don't know if they're out yet. But in 2022, less than 7,000 pass applications were submitted to the Social Security Administration for the entire country. Think about that. We're a country of 350 million people. Less than 7,000 people decided to use this free money resource. So pass plans are free money. Essentially, you can take whatever money would typically be deducted from your cash payment, and apply it to a future expense that will help you work, either go to work or work more. This is oftentimes used for a car, training. I helped somebody get a pretty cool $3,500 recumbent bike that they could then use to ride their bike to and from work. Sky's the limit. You can use it for college tuition. Know that that is something that is out there. File it away as something that perhaps you could use assistance from a benefits counselor with. Property essential to self-support is going to apply to self-employed folks. So if you have a micro enterprise, a classic example is Social Security allows you to have one car, but a second car is going to count as resource. But if I run a cleaning company and I need a fleet of vans in order to make my cleaning company work, then Social Security is going to allow that fleet of vans to be exempt from any resource limits related to my SSI. Same goes for money. If you have a separate business account, that business account can exceed that $2,000 limit when you receive SSI if it is linked specifically to your business. We also have IRWEs and BWEs. IRWEs, or IRWE, stands for Impairment Related Work Expense. BWEs, or BWEs, stand for Blind Work Expense. IRWEs, as the name suggests, are impairment related. So these are expenses that you pay out of your own pocket that you are not reimbursed for, that are both related to your disability and also necessary for you to work. Think about things like medication copays or specialized transportation, or I've even seen things like someone's cable bill because they really needed to be able to watch Game Show Network to calm down after work in order to be able to work the next day. You can also do expenses for emotional support animals, things like that. BWEs, or blind work expenses, are only available to individuals who have a statutorily blind determination from Social Security. So the Social Security Administration will have that on your documentation. BWEs are a lot better than IRWEs because it's any work expense. It doesn't have to be related to your impairment. So someone who is blind could count the lunch that they purchased while working as a work expense because it's related to work. It happened at work. Anything up to and including income taxes can be a BWE. The reason, I always like to make sure to say this, the reason that BWEs have such a better rate of return, they're more open, you get to keep more of your money with a BWE, is really because the blind community really banded together to do that lobbying specifically for their community. So it's incredibly important when you get these email blasts that talk about legislative advocacy or the budget hearing that Judy Mark is at today, or any of those things. Know that your voice matters. This is one small example of something that was really effective when a community banded together and talked to legislators. I also want you to know about the Student Earned Income Exclusion, SEIE. This is open to students who are enrolled in school or a transition program, aged 18 to 22. The Student Earned Income Exclusion allows you to exclude all of your money, all of your earnings up to a certain amount I think it's around 9,000 for 2024 before your SSI cash payment is touched in any way. So it really incentivizes students aged 18 to 22, usually in their first job, to really go for it and have no fear in earnings. Lastly, 1619B, that's the one that helps you keep your Medi-Cal. You guys, it's so great. You can make so much money that your SSI cash payment goes away. You're not getting it anymore. You don't have to apply for it. You just automatically get to keep your Medi-Cal because of 1619B, a provision in the legislation. You can make up to, I think it's $67,000 in 2024 before the system even starts asking the question, right? $67,000 a year. You're golden. Keep your Medi-Cal. You can have no share of cost. It's just yours. You don't have to do anything. But let's say you make $75,000 in a year. Okay, now you can ask Medi-Cal to apply what's called your individual rate. So that means that Medi-Cal will look at the total amount of money they spend on you in a year. That means that the cumulative total contribution for your medical care, for your waiver services, some of which are going to be self-determination services, for your IHSS services if you get them, right? When you combine all of that money that the Medi-Cal system spends on your care, that ends up being quite a lot of money. You have to make enough money to fully replace what they spend. So if Medi-Cal spends $120,000 in a year on your care, that's how much money you have to make before you can lose it. Imagine that. If you make $120,000 in a year, you probably get healthcare through your work, right? You can probably buy some pretty substantial insurance. So remember, with SSI, you can keep your Medi-Cal. That should not be one of your concerns as you move forward. The last thing I want to talk about here is just the $2,000 resource limit, income versus resource. This isn't a work incentive, but it's something that really plays into people thinking about work, so I always want to mention it. Money is considered income in the month that it is received, and then resource if it lingers in your account a month later. So if I have $1,999 in my account on February 29th, it's still there March 1st, that's resource. And then on March 1st, I get a deposit of $5,000. That's income. I now have $6,999 in my account, but $5,000 of it is income and $1,999 is resource. So if I spend that $5,000 on rent and bills, maybe put some of it in my ABLE account, which I'll mention a little bit later, you're golden. You never went over the resource limit. You can't always count on Social Security doing their own, checking on your bank statements and what the ending balance was. So you need to be prepared for that if it ever comes up. But don't think that you need to worry if there's a deposit mid-month and you get paid. Next slide, please. Okay, so the main takeaways for an SSI beneficiary, the biggest one I want you to take away is that it is always, 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 always more profitable to work on SSI. There is no limit or amount of earnings that makes it less profitable to work more while on SSI, okay? You can keep your Medi-Cal while you're working, and even if you stop getting SSI every month, your Medi-Cal is protected. You're going to be able to keep it. Next slide, please. All right, here is our second benefits profile. These are Title II benefits. This encompasses SSDI, child disability benefits, and disabled widow benefits, also known as survivor benefits. I'm not going to get into widow benefits today because it's not so common in our community, but I will talk about the others. I'm I do want to kind of highlight, anybody notice SSI, which is super common in our community, that's Title 16. Title 2, that's a much lower number in the titles, right? That's because Title 2 is the second title in the Social Security Act. This is the benefits profile that disability, as we know it, was written for at its inception. So this is what most people at the Social Security Administration are thinking about when they're talking to you about benefits. This is really the profile that the system was designed for, and SSI was really kind of slapped together later. And even with that, we'll talk about in just a second when we get into work incentives, the profile of SSDI. That's really what these work incentives were created for. So just keep that in mind as you go through and you think about, why doesn't this make sense for my situation? It might be because the legislation wasn't really written for your situation and you're kind of cramped into this category. Okay, so I see just a little preview. Does Title II include DAC? Thank you for that. DAC stands for Disabled Adult Child, and that is what the child disability benefit was called until the late 90s, at which time it was changed to child disability benefit. So CDB and DAC are used interchangeably, and interchangeably at the Social Security Administration as well. Sometimes they'll print documents where it's not updated even. Okay, so into what it is though. So I've been talking a lot about it, I haven't defined it yet, right? What is the profile of someone that receives a Title II benefit? So Title II benefits are always based on a work record. So it can be yours, my work record, or it can be someone else's, and then also a disability. So when it's based on my work record, it's SSDI. I myself, me, Pam, I've been working for a very long time. I have enough work credits to qualify if I get injured. If I leave my house tomorrow and I get in a car accident and I can't work for a couple of years, I'll get SSDI based on my own work record. It can also be based on someone else's work record, either a spouse, that's the widow's benefit, or a parent. So if you've had a disability and your disability began prior to the age of 26, and then you're considered a dependent, and then your parent either retires or dies, and they worked enough to pay into the system to collect Social Security, then you can collect on your parent's work record. In terms of the rules that apply, a Title II benefit is a Title II benefit, and there's no meaningful distinction in terms of the rules between the two. A good indicator that someone receives the Title II benefit is that they have Medicare. Medicare always and only comes with a Title II benefit. There is no way to get Medicare without either having a Title II benefit or being 65. So if someone tells you I get SSI, and then they also say they have Medicare, that means something about their benefit situation changed and maybe they're a little confused. They always have a Title II benefit if someone has Medicare. You don't need to be poor to get it. It's not subject to the resource limit at all. Title II benefits are entitlements through and through. Someone paid taxes and now you get it. It's like insurance. If you pay the premium, which is what Social Security tax is, then you get the benefit. And that's it. That's all it is to it. So it only cares about earnings as a result of work. So whereas SSI cares about any source of income because it's primarily a poverty-based benefit, Title II benefits, your great Aunt Sally can give you $1 million a month as a gift, and you'll still get your Title II benefit if your earnings allow it, okay? It's also what's called an up or down benefit. So you either get it or you don't. There is no decrease with earnings. It just is you get all of it or you get none of it. Substantial gainful activity, also known as SGA, can then create a shelf because if your countable earnings are high enough, you might not get your benefit. And it can be a little wonky the way that it works. Next slide, please. So just like with SSI, Social Security wants you to work with Title II benefits as well. Title II benefits come in two general categories. There's timeline incentives, which help you keep your benefits while you test out working, and countable income deductions that help you keep your benefits generally. Next slide. So let's talk about each of these categories of benefits. First, we're going to talk about trial work months. You get 9 of them. They make up a trial work period. During these 9 trial work months, no rules apply. So any month that you make more than a certain threshold, it's about $1,200 a month this year, but Social Security increases it every year. A month where you make more than that, your gross, counts as a trial work month. During your trial work period, you can make $1 million a month, or you can make 15, and it doesn't matter. You get to keep your benefits, your healthcare, no rules, go wild. This is your time to test it out. Once you use all 9, they don't have to be consecutive. So you can use 3, not work for 3 months, use another 2, not work for 4 months, use another 1. You can collect them within a 5-year period is the way that it works. Once they're gone, they're gone. That incentive is gone. It's off the table. It does not reset. There is no reset. If I've known people who used their trial work period in the 90s and then came to my organization for employment services a little bit later in life, and we just have to work with it, that's gone, okay? Once your trial work period ends, begins your extended period of eligibility. Extended period of eligibility is a period of 3 years beginning when your trial work period ends, where any month that your countable income is above the threshold, you don't get a benefit. And any month where your countable income is below the threshold, you do get a benefit. Pretty simple, right? So you get an additional 3 years with that safety net to test things out, make sure work really is sustainable for you. Then we have your extended period of Medicare eligibility. This is an additional period for, I believe it's 7 years after your trial work period ends, where you can continue receiving Medicare even if you're not receiving your cash payment from Social Security. So some additional safety nets to make sure, yes, work really is sustainable. And then lastly, there's expedited reinstatement, which says that if your benefit is fully terminated due to work activity and you have to stop working because of your disability, you have 5 years where if you have to stop working, Social Security will restart your payment before they're done reviewing your application. And that way you have some additional security of, oh gosh, if things really, go to poop, I'll be able to get that restarted quickly. Okay. I want to spend just a moment to kind of highlight, notice how all of those timeline work incentives, they're linked to when the trial work period ends. So if you use all of your trial work months, and then the clock is ticking on those, and if you stop working or work less for 10 years and then decide to go back to trying to work more, things like the extended period of eligibility, that's over. The clock ticks on those regardless of whether you're working. So this is how, remember I said the law was written for a certain subset of people, right? The law was written in 1939 for wage earners, heads of households, people that were supporting a family to work full-time, safety net if they're injured, with an expectation that they would return to a career that they had already built. That is typically what someone on SSDI is doing, right? Like me, my example. I have SSDI, I built a career, I get injured, I'm off work for a few years, I get some support to try it out again, but I've already built a career, so I'm returning to it, right? That's what the law was made for. The child disability benefit, that is not necessarily assuming people are going to go to work. That's assuming that there is a dependent who needs to stay dependent on a parent's income. So the law just isn't really made with Title II. It's not designed for people entering the workforce, right? So that doesn't mean that we don't enter the workforce. There's still lots and lots of stuff here. It just means, we're fitting a round peg in a square hole. And so you might need a little bit of extra support figuring out how to do that smoothly. There might be some letters that come from Social Security that you need a little bit of help interpreting that maybe sound scarier than they are. You should not assume that it means you can't work, because you can. So let's talk a little bit about countable income deductions, because I kept saying if your income is above the threshold, you get the benefit. If it's below the threshold, you don't, right? Or you keep the benefit. SGA is the threshold. It's $1,550 a month in 2024. That goes up every year. It usually in with California, it usually works out to about 20 hours a week at around or a little more than minimum wage. But that's a generality. But Social Security does not count all of those earnings. So this is how you keep your income below the threshold if this applies to you. The first thing I want to mention is special condition. That's having a job coach. That's having a support person who is with you during your shift and necessary for you to perform your work. The way that that works is anytime you have your support person with you, your wage just doesn't count. They say that you can't possibly be performing substantially if you have a support person present with you. Now, we all know that, of course, you can perform substantially if you have a support person with you, but why not take advantage of the security that Social Security gives you, right? Second is subsidy. These are any accommodations or investments, perhaps, that your employer makes on your behalf, okay? If you take extra break time, if you work a little bit slower than other people, if your supervisor maybe spends a little bit of extra time training you, all of those things are investments that the business is making into you as an employee with a disability, and they have a dollar amount attached to them. So if, as an example, you work about 80% the speed of other employees that don't have a disability, then only 80% of your wage is countable. Those can be combined. All of these work incentives can be combined. Lastly, there's ERWIs and BWIs. So if you spend $100 on cat food for your emotional support cat, then $100 is knocked right off the top of your gross wages. So in that way, you can potentially make quite a lot of money gross and keep your benefit, both your cash payment and also your healthcare. Next slide, please. All right, so our main takeaways for Title II benefits. One is that SGA is not a hard line. You really might be able to make more and keep your benefit. The number one question I always get is, how much money can I make? How much money results in you having a good life? That's the answer to that question. What makes a good life? We'll go from there. And two, working with a benefits counselor can really help you plan out your earnings so that you can hit your earnings goals. Don't let fear be the barrier. You can work if that's your goal. Absolutely. Next slide, please. Lastly, we're going to talk about concurrent beneficiaries. This is the last benefits profile we'll talk about. These are individuals who receive a little bit of both, a little bit of Title II and a little bit of Title 16 benefits. These individuals get Medi-Medi. So if you've ever heard of that term, it stands for both Medicare and Medi-Cal. And you can make use of both sets of work incentives applied to each benefit separately. You can theoretically lose one, but not the other. Title II is unearned income, so it's treated a little differently. It's an almost dollar for dollar deduction from SSI. You are still subject to the $2,000 resource limit, and it's perfect pass potential. So remember, I said that pass is an SSI work incentive that takes income that would otherwise be deducted from SSI, and you can apply it to a savings account where you are going to buy something that'll help you work. If you have a Title II benefit, that's being deducted from your SSI. You don't even have to begin working. You've already got it available to set aside if you have a purchase that would help you work. So this is a great benefits profile with a lot of perks. It's also important to note that SSI and Title II are completely separate programs, and Social Security, they have separate rules, and they also have separate staff. So a claims rep will never work on both SSI and Title II. They have different wage reporting requirements. You can report your wages for one, and it does not get reported for the other. They don't talk. They're pretend like it's separate administrations. It's like it's not the same department. So great potential. Oftentimes, it's the most complicated though, for sure, right? Next slide. So what are the main takeaways here? It can be a great benefit situation for returning to work, but this is probably the one more than any other where I would say, due to the complexity, working with a benefits counselor to increase your earnings is definitely recommended, right? This is also oftentimes, I think, the scariest for folks. Anytime someone comes to me and they're just like saying every rule in the book, and I'm scared of this, and I'm scared of this, and I'm scared of this, it's almost always because it's someone who gets a little bit of both of these. And so they have been told all of the scary things from Social Security applying to both benefits, but just haven't had the full picture. Please, please, please call me. If this is your situation and you're scared and you want to work, let's talk. Okay, next slide. Which brings us to, where do I find a benefits counselor, right? So I've been hearing about all of this cool stuff that can help me work. And I've also been hearing about how, just heads up, this is an incredibly cursory training. This is by no means something that prepares you to do benefits counseling, right? Okay, I need a benefits counselor. How do I find one? Well, next slide, please. If you have self-determination, you could potentially hire me. Progressive Employment Concepts provides individualized benefits advisement services through the self-determination program. You're going to be provided with all of this. I've got a handy dandy menu here. You can have a benefits analysis report. So that is a full kind of comprehensive written report that talks about your benefits situation as it is right now and how earnings could affect it. That's usually 7 to 10 hours. Advocacy. So for example, I didn't know that I needed to charge my kid rent in order for them to get the full SSI payment. Please help me talk to Social Security. Depending on the situation we're talking about, usually like 3 to 5 hours per issue for me to step in and help out with that. You get a big scary packet called a work activity review from Social Security. They want information on the last year of your work activity. That's usually 7 to 10 hours if you want my help filling it out. Support staff or family training and consultation and creating custom templates. This is usually 10 to 25 hours annually, or possibly just in the first year, depending on what you want, right? If you just want me to create templates for you and then you'll use it, I can do that. Analysis of how earnings are going to impact your benefits, 2 to 3 hours. If you just want me to kind of review letters and be a security blanket, I think I know what I'm doing, but I got this scary letter. Do I know what I'm doing? I can help with that. It's usually 1 to 2 hours a month. Analysis of how resource or gifts will impact your benefits. It's probably going to be about 2 to 3 hours. Past plan support, 25 to 35 hours annually. And lastly, Progressive Employment Concepts charges $150 an hour for benefits advisement services if you're thinking about putting that in your spending plan. Employment supports is service code 335. That oftentimes works for people. I've also had people use 339. just as a heads up. Next slide, please. Now, what if you say, I want to work full time and I have a small budget. I don't really have $150 an hour and I don't have time for this either. I want to go work full time. Then Ticket to Work is for you, my friend. Ticket to Work is a program that is funded actually by the Social Security Administration. These are designed for people who want to earn more than SGA, so more than $15.50 a month, and they need help managing their benefits in order to reach their goal. The way that Social Security funds it is tied to you meeting your earnings goals, so it really is designed for folks who want to earn more than $15.50 a month and are planning on doing that pretty quickly. But in this circumstance, Social Security will fund your benefits counseling. We do that at Progressive as well. You can email us at ttw@progressiveemployment.org. It's also up on your screen. You don't have to use us. This isn't just an advertisement, right? This is a training. You can also go to choosework.ssa.gov and find someone perhaps that's local to you or that'll do everything online or whatever it is you need. Next slide, please. All right, so hopefully now we've gotten you to a point where you are comfortable with your earnings, you are comfortable with your benefits, you are working a little bit, but now you don't know what to do about that resource limit. You get SSI and you're not allowed to have more than $2,000. What do you do? Because hopefully you're working enough to save. Next slide. You get a CalAble account. Hopefully some of you have already heard of this, but if you haven't, this is a really cool kind of savings account that allows the beneficiary to save money without being subject to the resource limit. This money is shielded from all federal benefits. Less meaningful now that like Medi-Cal that's not associated with SSI has removed the resource limit, but regardless, it's completely shielded. So you can have over $100,000 in it total before it impacts your SSI. Money can be deposited to the account from any source, so it's a great way to avoid things like in-kind support and maintenance. It does not exempt you from counting income. That's a common kind of misunderstanding when people look at it. If you have, for example, your paycheck direct deposited into your ABLE account, it's still your paycheck. You still got paid that money, so it's still earnings. You can visit www.calable.ca.gov for more information. Next slide, please. Love to have Mr. Tim Jin talk to us. I'm going to mute.
Hi, Pam. It's been a long time since we talked, like 8 hours ago with our funny side jokes while handling my benefits. I want to disclose something before I give my talk. Pam is my benefits specialist. I just wanted to put it out there. Pam and I have many side jokes. Let's go on to my talk. My first job was in high school. I was friends with a neighbor, and he was starting a business in his garage, and he knew that I was good with computers and offered me a job after school to help him to do computer stuff and data entry for a few hours a week. When I told my parents that I wanted to work for our neighbor, they were surprised that anybody wanted to hire me. But their mindset changed that I was capable of working even for minimum wage, which was $4.25 in 1995. I still eat way more than minimum wage even back then, and my food bill is even more massive as I've gotten older. My inspiration grew from my experience working for my neighbor even when I was a young punk and listened to ska music in high school. My neighbor taught me that I was more than capable of working, and more importantly, the employer saw my skill level as an asset, rather than a deterrent and liability. Throughout college, I've always held a job, either on campus through Disabled Student Services and the High-Tech Center, or consulting jobs, like working for Universal Studios for their network security. I was still making minimum wage and not working enough to affect my benefits, but that triggered me to get gainful employment after college. There was no more hesitation from my parents that I would work for a living, even if it was part-time or even affecting my benefits. My mom and dad insisted that I work, not so much for monetary value at the time, but I needed meaning in my life. After graduating from college, I got a job through my personal friend and worked over 15 years at an educational publisher, part-time, 20 to 25 hours a week, and still making minimum wage. Thankfully, my advocacy work and speaking career were slowly taking off, and at some point, I was making more than what I would make in a week at my day job, versus speaking on stage at a conference. And I still do. Losing my benefits was a huge concern to me and everyone that I know who has a disability. I was constantly getting overpayment notices from Social Security, even though I mailed in my pay stubs every month for SSI. It was like playing ping pong. One month you are good and the next month you get dinged for overpayment. There were a lot of calls with Social Security, asking if they got my pay stubs yet and etc. Until one day, I got a letter in the mail, telling me that I no longer would get SSI, and I had enough work credits to qualify for Social Security disability insurance. At the time, I had no idea what they were talking about. My caseworker at the Social Security office at the time spoke to me and explained the difference, and he pretty much told me to switch to SSDI and I would no longer have to mail in my pay stubs, as long as I made substantial gainful activity at the time. Fast forward to when DVU decided to offer me a full-time position, and you can see some of my colleagues having their cameras off and swearing at the wind because I can be a thorn in their side for reasons that I can't say. After all, this session is being recorded. I was a bit hesitant to work full-time, but it was a nightmare, trying to figure out how many hours can I work without affecting my benefits. There was a lot of correspondence with the human resource lady, and after a while, I stopped billing for some of my hours because it was becoming too hard to stay within the income limit. I finally took the plunge, asking my IF to look into this further, and I interviewed a few benefit specialists and decided to go with progressive employment. Within just a month, they assisted me in establishing my work incentives planning and assistance, enabling me to retain crucial benefits like insurance and my SSDI. I'm enrolled in the Working Disabled program administered by my county to maintain Medi-Cal and other essential support services. Furthermore, because I require assistance while working, the wages of my support staff do not impact my eligibility for SSDI, ensuring I can continue to receive it. Looking back at how far I have come through self-determination, I sometimes have to pinch myself if this is for real and also yell at the wind about how busy I am. I refuse to buy into the myth that suggests individuals with disabilities should shy away from work for fear of losing their benefits. It's a misconception that we must dispel and move beyond. Oh, good.
I have to say that when Tim sent me his speech, I was so touched by it. And it's like, I think his story is so amazing. And I think he really hit on the key, which is we can't let these fears um, stop us. We have to push through them and get the help that you need, and the help is out there. So that's if you learn nothing from this training, know that there is help out there for you and to go and seek that help. Tim, I want you to know that I spent 3 hours today on the phone, wait on hold on SSI, trying to get through to them because we got a overpayment letter for my son saying we didn't send his pay stubs in when I did, and I faxed it to them 3 times. So we know that Social Security is a challenge and it's hard. And so I really do recommend getting the help that you need. I'll tell you, as a parent, my biggest concern has always been what happens when I'm gone? Because how difficult it is for me, and I've been doing it for years for my son. You know, my sister who will take over to help my son will have no idea how to navigate this world. So having supports in place that not only can help, my son, but that can help anybody in the future who's going to help him is really important too. So, like Tim, thank you so much for sharing your story. Pam, you are so like I can't even tell you. I don't know how you keep all of this in your head. It's insane. I want everyone to know that everybody's case is so different. So this presentation was on generalized information. It is important that you do seek out help that is individualized to your specific case. So with that said, we I think we already had this up before, but we will make sure that everybody has the links to these slides. Again, you're going to probably want to watch the video a couple times. I know I'm going to need to watch it a couple times to re-hear these things. I need to hear them about 20 times before they'll get into my thick skull. The videos for our connects go up. It usually takes us about a week, maybe a week and a half, because we get the interpretations recorded as well. So all 3 will go up onto our YouTube. So keep an eye out for them there. And what I'm going to do is I'm going to ask everybody to do that final survey for us before we go to questions. Thank you. Thank you so much for doing this. I know it's kind of a pain. This is the same questions you heard at the beginning, plus 1 extra question. So if you can answer those really quick, the link should be, oh, there's the link in the chat. Go ahead and do that, and then we will get to questions because I'm sure there are lots and lots of questions here. So as people are doing that, I want to remind everybody, the way we do questions is you can either raise your hand or put your questions in the chat. You can also, if there were questions that you posted earlier, we have gathered them all and we kind of go back and forth between the chat questions and the raised hands. And we'll just kind of work through the questions that we have. The first question that we have is from Maria at 5 p.m. And she said, my son gets SSI and Medicare. Is that right?
Probably not. So I always want to preface these things, right, with I can't possibly answer specifics about your individual situation. I don't have your paperwork in front of me. There's a lot of verification stuff that I do when I'm working with someone. But I can tell you with great certainty that if someone receives Medicare, they definitely receive a Title II benefit. Whether your son also receives SSI, maybe, very possibly. So that's what I can say is if your son receives Medicare, he definitely receives the Title II benefit, and there might be other factors as well.
That when you got to the Medi point, I think my head might have exploded. I
So
went, "Wow."
Medi is such a great situation because you have the Medicare that everybody takes, but your Medi-Cal pays your premiums and your copays. So now all of a sudden, all the doctors that don't take Medi-Cal have to.
Oh, so I've heard people talk about it and that it's amazing, and it just it hurt my brain. So,
And that's how you get it.
and that's how you get it. Exactly. Um, I'm not sure how to pronounce it. Is it Makai? Would you like to unmute? Oh, there we go.
Hello, and thank you so much for bringing this discussion. I work as a systems change advocate at a CIL, and I cannot tell you how many people are in fear of losing the benefit, would like to go back to work, and could use the extra income, especially in California, that employment can bring. Personally, I just wanted to share. It would be great to have this discussion during transition time for people at regional centers or at schools just before they leave high school or in middle school, because things can change, and during the transition period, when we're looking for our children to either go into vocational or post-secondary opportunities and all the challenges, just to do the academic piece, to then have to think of the SSI, Social Security can be so overwhelming. So I just wanted to maybe ask about maybe if there's something we can do as parents, advocates, is to inform or the requirement of economic stability for our kids in terms of benefits, training for parents, and the teaching, so that our kids and parents and advocates can support this process instead of
Makai,
being so confusing, terrifying.
Makai, thank you. So I agree with you 100%. And that transition time is so key, right? I think that's in our in part one of What Works for Us, we talked a lot about keeping expectations high. And I think when sometimes their loved ones have the fear of losing services, we don't keep those expectations high. So I think that I love that you talked about reaching out, and everybody, on this call, sharing this information with other people, knowing that there is help out there. Like you said, it's so difficult knowing that you can have help with this, I think is really, really the key. Like, you don't have to figure this out on your own. Nina, are you here? I know that you wanted to speak. Can you unmute? Or
Yes, I did. Can you hear me?
there,
Okay.
oh, there
Can
you
hear
are.
me?
Yes, we can hear you.
Yay. Great. Thank you, guys. I'm sorry to pop back in. Wow, what I heard of this is so fabulous. This is like the best. But Judy insisted, as you can imagine, I obey. Judy speaks, I obey. And so she is as we speak, there is a budget subcommittee 2 that's on developmental services hearing going on, and Judy's on several panels. She thinks it is going, I mean, it's intense. There's many topics, but her estimate is that after this Fabulous Connect is done, there still should be the panel on the SDP still, you'll still be able to catch that. So she's recommending to everyone who can check it out when this is over, and see if that's still going on. I did my best to put the link in the chat, but maybe Kira or Erica or anyone else who's around, the link to that hearing is in our weekly email. So it should be good. Anyway, give it a try. It's Assembly Budget Subcommittee 2. And so far, I will say, I think Judy would love for everyone to just hear kind of DDS in the raw. But anyway, I won't take up any more of this time. This has been so great. I've been trying to do listen to both at the same time. So thank you so much. Sorry about that. And keep going. This is awesome. Bye.
Thanks, Nina. We will definitely jump over there. As soon as we answer these questions, we will pop over there. I can't wait to hear what's going on. So we had a question in the chat, and it was from Linaire at 509, and it said, you mentioned your training. If we are looking for someone with your background, what training should they have?
What a wonderful question. So the training I have is called CWIC training. So that stands for Community Work Incentives Counselor. The training itself is CWIC training. Anyone who has those letters or the letters WIPA, WIPA, next to their job title or the program, if it's advertised. WIPA stands for Work Incentives Planning Assistance. Those individuals, WIPA staff, also have the same training as I do. The difference between a CWIC and a WIPA staff is that WIPAs their salaries are funded from a grant for Social Security, so they can't turn people away. And there's a priority list on how close you are to work for them to help you. And it's typically initial questions, not ongoing support. And then CWICs, like me, we help people funded through whatever means we're funded by. I'm not directly funded by a WIPA grant, which means that I can turn people away or have a wait list. Or have eligibility criteria, such as you need to be a regional center service recipient, whereas WIPAs do not have the ability to restrict their eligibility criteria that way. But those are the letters and the trainings that you're looking for, is CWIC and WIPA.
So many acronyms.
I know. DRC has a WIPA in San Diego.
Oh, that's good to know. Elena asked, is that the training from VCU?
That is the training from VCU. Who knows VCU here?
Elena Tiffany, who is, I don't think she has her camera on, but she is my assistant for SDP.
Deep cuts.
Yes.
Okay. Yes, VCU is where I got my training.
Joanne, would you like to go ahead?
Hi, yes, thank you. This has been very informative. I have my 27-year-old daughter, as of Monday, did a SIP and a PIP. So, okay. So, which is a state internship and then a paid internship. Her job is ending February 29th. Right. So throughout that time, and she is very good about sending her Social Security stubs. And of course, Social Security didn't keep up with her. Right now, she's not getting any Social Security because her income was above the threshold. So, but she is owing Social Security $4,000 because they did give her benefits, even though she was sending the pay stubs. So now we have a big overpayment, but they're fine. She's paying $100 a month. What's going to happen now, February 29th, she's going to get one more paycheck, and then she's over with the PIPs and the SIPs. So she will be reinstated, I'm hoping, to Social Security. But if not, if it's 12 months, she has to, do you see my dilemma?
I do.
Okay.
I do.
I mean, I'm not,
Yeah.
yeah.
So
what,
yeah, my very first thought is how sad it is that she got two separate forms of supported employment that did not result in employment. And wow, is that a whole nother topic of conversation within our service industry about how, as service professionals, perhaps we should support around some of those
Right.
things. But setting that aside, in general, her payments probably will resume once Social Security is notified and given proof that she's no longer working.
well, so that brings me to one more, because we're having our telephone call, and you know how it is.
Let me pause you. Let me pause you, because I have to say the caveat is that this is a very specific micro situation to your daughter that is going to depend on how much money she's been making, what type of benefit you're talking about, how long this has been going on, whether or not there's any other complicating factors, such as sometimes a parent's retirement account can be a complicating factor. So if she gets SSI specifically, then payment should restart. If she gets a Title II benefit, it's more complicated, and I can't answer that in this setting.
So, okay, so then I'll cut to so my other question is, when you talk about a job coach, in SSI, are those hours that she's had a job? No. Okay.
Nope, doesn't matter.
Because as you said that, I'm thinking if I subtract that, we're back to
Nope.
golden.
Doesn't matter. Those only matter for Title II benefits. The only circumstance in which those matter for an SSI beneficiary is if they are applying for a Title II benefit. So sometimes this happens. Someone will be working and maybe making $2,500 a month as an SSI recipient, and then parent retires. And that's when you can say, oh no, I know that you think I've been making $2,500 a month for the last 15 years, but I've had a job coach with me the whole time. Actually, my countable income is $1,000 a month for the last 15 years. Please give me my parents' benefit. That's the only time that it counts.
Okay. So we'll just, and then we have our annual meeting with her person on Tuesday. So we'll bring up that she's not going to be employed and see how far we get.
So Pam, there was a question in there that I was curious about, which was, if somebody was working and they become unemployed, how do you let the Social Security office know that they are not working any longer?
Great question. So you can call or fax or mail or send something in person. Social Security, if you call 9 times out of 10, they'll tell you to fax or mail something, but what they want is the last day that you worked. And usually when you end work, they give you some sort of proof, right? They give you a statement that says you're entitled to unemployment, this was your last day or whatever. Send that to Social Security. And then the other thing I want to also mention is, and then watch your bank account. So there are clear calculations that you can use every month. If you get SSI, you know how much you're supposed to get. And so if you start working and they pay you too much, they're going to notice it. They're going to notice it next month, or they're going to notice it in 10 years, but then you're going to owe the money. So take the time to make sure you know what the benefit is supposed to be given your situation, and watch your bank account. And if you get overpaid, you say $4,000. If you get overpaid, put that sucker in a high yield savings account, maybe in somebody else's name. And then whenever it is that they notice, give them all the money, keep the interest.
That is a very good advice. What we did because we had the same issue where we kept reporting it, they weren't deducting it, we moved it to my son's Able account. So
Yeah.
he had it when when we knew it was coming. We were waiting for the day for the letter.
Right.
We have a question from Christine at 5:13 p.m. When young adults become eligible for Medi-Medi based on a parent retiring, what do we do to have to get it?
When you, the parent, are applying for your Social Security and saying you want to begin collecting, inform the Social Security Administration that you would also like your child with a disability to begin collecting on your record. It is technically automatic. Like if you die, Social Security will give your benefit to your child with a disability and you don't have to do anything, but they're going to have to fill out an application packet. Because they're two separate programs, it's a whole, they have to redo eligibility. It's a given because obviously having a disability determination from the Social Security Administration is strong evidence that you meet their definition of Social Security of disabled. But in order to expedite it, tell them, they'll send the application. There's a 2-year wait period before you get Medicare after you get the cash benefit.
Okay. Now, do you have to, as parents, do we need to notify Social Security that we have a loved one with a disability? And at what point would we do that?
So they're supposed to know because presumably you have claimed them as a dependent on your taxes at some point throughout your life. You notified Social Security that you were the parent when you requested a Social Security number from the Social Security Administration when they were babies. So it should be known. However, there are definitely circumstances where that is maybe murkier for a variety of reasons. And it certainly does not hurt to make sure Social Security has their Social Security number linked with yours. But if you have a fairly traditional family makeup that included you being on your kid's birth certificate and you were the one involved in asking for a Social Security number to be assigned, you've claimed them on your taxes. If it's a traditional situation, they're already aware.
Good to know. Russian, would you like to unmute?
Yes, hi. Can you hear me?
We can hear you.
I can hear you.
Okay, perfect. Thank you. So I want to know if my daughter's is on I just learned that it's not SSDI, it's actually adult child benefit.
Uh-huh.
Do I have to report her income monthly?
Not for a Title II benefit. No.
No.
Title II benefits report wages via the work activity review, which often happens annually, but really happens whenever Social Security decide they want more information about your work activity. So I say no, qualified with if she also receives a little bit of SSI, even if it's only $1, or if she has an SSI case file open because she's in 1619B. If there's not a complete and total overwhelm and SSI is in the picture at all, she has to report monthly for SSI. But for Title II, no, you don't report monthly.
No. Okay, I have another question. If okay, so she's getting Title II benefits. Is it possible, let's say, if she gets an inheritance, let's say, or a big chunk of money, not from earnings, but from, let's say, inheritance, can she lose her Medi-Cal part?
No.
She's Medi-Medi. Can somebody lose, like, if somebody's on Medi-Medi, can they lose their Medi-Cal part, which is part of IHSS?
If she's Medi-Medi, that makes me wonder about her category of eligibility and if it is in fact SSI associated. So I don't want to answer your question because I don't feel like I know enough about her specific situation to be able to say that. But like, probably not.
So I would say reach out to Pam so she can go through, and I think it's, and I think maybe I'm super dense, but I think it's really hard for
Yeah.
parents and participants to know what service we have because it's not clear to us. So even if it's reaching out to a WIPA or a CWIC just to find out
Yeah.
what are you on? What program are we on? So we know what rules we have to follow. It might be a good place to start. Lori Walker asked, how do they calculate the Title II benefit for your adult disabled child who is on SSI?
It is usually 50% of your benefit. So if your benefit is $4,000 a month, they'll probably get $2,000 a month. If you do not have a spouse claiming on your work record as well, then I think they can get up to 60%.
Tracy, would you like to unmute?
Hi. Well, I take care of my brother that's got the disability. So I was still trying to figure out exactly how much because he gets the SSD, I believe it is, as well as the survivor's benefits from my father.
Got it.
How much really is he allowed to possibly work if he wanted to work part-time type
I
thing?
don't know. Probably more than you think.
Okay.
But I love that your brother gets two kinds of Title II benefits. I wonder is he a triple threat? That could be interesting.
What's a triple threat?
Triple threat would be someone who collects on two different work records for a Title II benefit, but still gets a wee bit of SSI. Probably not if he gets both, but I have known folks. I know one person who has a little bit on his own work record, a little bit on his mom's, a little bit on his dad, and it's still everybody works part-time, I guess, because he still gets like $2 a month in SSI. So he gets 4. I don't know. I'm never gonna answer.
Oh yeah, it's just like it's kind of hard to know. It's like,
yeah,
would they start taking away after a certain point? But it's like,
but no. But does he use a job coach? You know, does he take extra break time? Like, I feel like this is a situation, and I'll say it again. If you receive self-determination services, you can hire me. You can email me later. Have your IF talk to me. We can get you in, and we can have this talk real specific to you.
Okay, I'm working on trying to get my brother on SDP, so I'm in that process.
Yeah.
So
I would say
make sure it's in your person-centered plan. Make sure it's so you can put it in that spending plan. You know, we wanted everybody to know about this so you can plan ahead for it. So when you get to that point that you're going to know you're going to have the ability to put it in your spending plan. So think ahead.
One more quick question. So does that mean my brother could also get my mom's Social Security as well if she had passed, even though
he can collect up to the maximum it would have been on a single wage earner's work record. So if you know they'll take whatever the maximum is on the wage earner who made the most money, and they'll say, okay, if the benefit from dad would have been 2,000, then we'll take 500 from his own work record and 300 from mom's, and the rest up to 2,000 from dad's. That's how it works.
Does that mean 2,000 all up or between the two benefits?
But between all of them. But the cumulative total of Title II benefit you can get cannot exceed whatever the benefit of the largest wage earner would have been.
Okay, because I know he's got just over $2,000, but it's like because regional center workers like, I've never seen somebody get that much money. So it's just like, I don't know.
Your dad must have had a good career.
Yeah.
Great.
So we
Okay.
have the next question, which
Thank
I
you.
thought was a great one, is, do you advise on micro enterprises?
Ugh. I advise on how self-employment earnings can impact your Social Security benefits. I am not an expert on self-employment. I think that the Small Business Administration is a really good resource for people who are opening or currently operating microenterprise. I can definitely help you figure out what your business account means for Social Security.
And perhaps a past plan.
And perhaps a past plan. Absolutely. I can definitely help you with a past plan to fund your microenterprise.
So hold on, I'm checking the time because I'm always bad about. Oh, we have 2 minutes. Valdemitra, I'm gonna let you ask the question.
Thank you. Thank you. Okay, my daughter is 33, going to be 34 in April. We are on the SDP program. We have our budget ends June 30th, so we're working on our new budget for next year. She's done the microeconomics training. But as far as all the Social Security stuff, she's on SSI.
Okay.
And she as far as the paperwork and things, I think your company is a great one because you can help us understand all these different things that's going to happen. Because my concern is like Christiana, is that what happens if I am not there? And they are always slipping paperwork in here. Now I am on SS. I'm retired myself.
Okay.
Her dad is retired postal worker. I don't know if we're connected to her. Well, I am because I'm her payee. But as far as his concern and stuff, I don't know if he's connected. We're not together. So
it sounds like something that maybe if you get an expert, they can help you research, figure out what benefits you're going to be able to access and all of that.
Yeah, I would strongly recommend you email me directly. I will leave everyone with this just weest bit of extra is if you have a state or federally sponsored pension, you can probably have your child with a disability signed up to receive your benefit after you retire or die from your pension. Also, that has other complicating factors for Social Security. Call me.
So before we go,
did you give us your phone? I'm sorry, did she give us her phone number or her email or in the chat?
I was just gonna say that
emails in the chat.
Pam, we've got requests. Can you put your email in the chat one more time? I think you are going to be bombarded, hopefully, and we are going to get everybody in this room the help that they need. Also, can my team put the link for the meeting, the budget meeting, again, the last thing in the chat here? So if people after we leave go pop over to that budget meeting and see what's going on. Don't forget, this is going to be recorded. We will see you for the third part of What Works for Us on the second Wednesday of March. Pam, thank you so much. I know you're going to have to come back because I know we have so many people who didn't get their questions answered. Tim, you are amazing as always. Thank you so much for sharing your story. And everyone have a wonderful evening, and we will see you next time.